This is QTV News and I am Jana Bosonko. Thank you for joining us. First, the main local news headlines. At an event to receive a donation from the Gambia Red Cross Society on Friday, the Education Minister announced that grade 9s will be back to school on June 24th. The 19th June is World Sickle Cell Day, set aside by the United Nations for people living with sickle cell disease. Lawmakers at the National Assembly on Thursday continued discussions on the Women's Enterprise Fund and the Persons with Disability Bill 2020. The First Lady Fatoumata Barbaro on Friday took delivery of medical items from the First Lady of the People's Republic of China to aid the fight against coronavirus. At an event to receive a donation from the Gambia Red Cross Society on Friday, the Education Minister announced the date of school reopenings. Our reporter Omar P. Jala was there and he fastened the support.
The donation of face masks and other materials is timely as the reopening of examination classes for grade 9 and 12 students become imminent. This comes after the government relaxed some COVID-19 public health emergency restriction measures. The COVID-19 National Coordinator Alassane Senghor said he and his team facilitated the partnership between the Ministry of Basic and Secondary Education and the Gambia Red Cross Society to help students to catch up with the lost contact hours and to be able to move to the next grade as required.
This is what is required in responding to any emergency, particularly COVID. We have seen in the past where people were giving in different directions. But what we need now is to ensure that whatever is provided is first and foremost needed, and secondly, it is coordinated so that it reaches where it is needed most.
The Minister of Basic and Secondary Education, Claudiana Cole, expressed concern over the lost contact hours while thanking the donors, but added that such measures are necessary for students and teachers to return to school safe.
These very, very valuable items that will go towards helping us and enhancing our ability to be able to get our students back to school. The students have been away from school for about 3 months. And I don't think anybody is comfortable with that situation with regards to the development of education in this country.
Minister Cole further explained that having these materials in schools will not only gain and win confidence of parents and society, but will equally provide some protective measures to our children. She used the opportunity to announce the reopening of schools for grade 9s.
I hereby have the singular honor to inform all school authorities, staff, parents, and students in particular, as well as the general public, that the reopening of schools for the grade 9 students is scheduled for Wednesday, 24th June 2020. The grade 9s will be going back to school, and that of the grade 12s will be announced in due course. As such, all the other categories of students are urged to stay at home until further notice.
The Acting Secretary General of the Gambia Red Cross Society, Abdullah Fai, explained that the Gambia Red Cross Society on Tuesday began a nationwide fumigation exercise of schools, adding that the exercise is expected to last for 5 days, targeting 500 schools throughout the country.
We have completed Banjul. Today we are in Kanifing municipality, and we have committed our human resource and our equipments to do this for all the 505 schools.
The Gambia has 674,300 students from early childhood development ECD to secondary school. Out of this number, 30,000 are in the 9th grade, with about 5,000 teachers. Reporting for QTV News, I am Omar P. Jallo.
The 19th June is World Sickle Cell Day, a day set aside by the United Nations for people living with sickle cell disease. In the Gambia, the day was celebrated with a local team, Sickle Cell Patients' Lives Matter. Babukar C. has the rest of that story.
The day is set aside by the United Nations to raise awareness of sickle cell at the national and international level following adoption of a resolution on the concept in 2008. The resolution calls for members to raise awareness of sickle cell on June 19 of each year at national and international level. In the Gambia, the Minister for Women, Children and Social Welfare, Madam Fatou Kinte, has this special message for the day.
Statistics are not readily available. However, records from the Department of Pediatrics of the Small Teaching Hospital shows that 568 children with sickle cell disease ranging from 6 months to 14 years are receiving medical treatment in our hospital. The sickle cell clinic is the largest clinic in the department, and it constitutes 5.28% of admissions. However, it is believed to be underreported as diagnostic means are not always readily available.
The president of the Gambia Sickle Cell Association, Alu Sambu, said this is the first time in 7 years that the ministry has issued a statement recognizing them, which he welcomes as a positive move. However, he believes more should be done to assist those living with the condition in this country.
We have a lot of challenges because here in the Gambia, people don't talk about their sickle cell status very well, and people are even feeling shy. People feel shy to talk about their status. They feel stigmatized because the stigma has been there ever since, which we're trying to break. And then, alhamdulillah, but we have a lot of challenges because since our existence, could you imagine, since 2007, we could not even have an office. And then we've been struggling ourselves. And then there is one unique thing about this association. This association was formed by sickle cell patients and is also run by sickle cell patients.
The acting chief medical director of the Edward Francis Small Teaching Hospital, Dr. Charles Roberts, gave the statistics of patients registered with sickle cell at the country's only referral hospital.
We run a sickle cell clinic every week, every Wednesday, where the patients come, seen, and they are followed up. So currently in the records, we are following up 568 patients. The age ranges from 6 months to 14 years. And every week they see about 20 patients in the clinics. It is the largest clinic in the department and forms about 5.28% of admissions in the department. However, this is believed to be underreported because some of the patients that come in with some of these crises are not actually tested.
The day also witnessed the official launching of the Parents Against Sickle Cell Association by the Minister of Women, Children and Social Welfare.
I got it from my parents that I had my first symptoms, sickle cell disease, at the age of 3 years, which first manifested as severe pains of hands and legs. It was so severe that I should tell my parents to tie my hands and legs. They had to take me to Edward Francis Small Teaching Hospital, where a blood test done was found to be positive for sickle cell disease.
Approximately 5% of the world's population carries trait genes of hemoglobin disorders, mainly sickle cell diseases and thalassemia.
Carriers can have children who don't have the traits.
That's what they said at the hospital. Well, we can have others. They may not be affected.
Statistics reveal that 5 million people worldwide are thought to have the condition. About 80% of sickle cell disease cases are believed to occur in sub-Saharan Africa and also affects people of African origin living in other parts of the world. Babu Karsi, QTV News.
Lawmakers on Thursday continued discussions on the Women's Enterprise Fund Bill 2020. If passed, the bill is expected to enhance women's access to finance. As Mamudu Gajaga reports, the Persons with Disability Bill was also discussed.
The Women's Enterprise Fund Bill 2020 was tabled by the Minister of Women, Children and Social Welfare, Fatou Kinte. The objective of the funding is to promote women enterprises and create self-employment.
There is a need to have a legal framework to set up the fund and define its operations and modalities. This will give assurance to our development partners that the fund has a legal mandate from the government of the Gambia committed to contribute 6 million Gambian dollars, and the European Union has also pledged to contribute 3 million euros towards the fund for a period of 2 years, pending the enactment of the Women Enterprise Fund Bill.
Women form more than 50% of the Gambian population, according to statistics. many of whom work in areas such as horticultural production, fishing and small-scale business. Despite their back-breaking labor in these areas, most of them live in abject poverty. Accessing loans from banks and financial institutions often incurs high interest rates and require collateral.
Honorable Speaker, the aim of the fund is to create a step to further empower existing women entrepreneurs as well as create and empower new ones, so that increased economic opportunity and stronger social capacity and capability and capacity to increase the community's prosperity over the long term.
National Assembly members expressed support for the bill but pressed for more funds so as to empower women through accessing loans from the fund. However, the National Assembly member for Serekunda, Halifa Saleh, says there should be caution on how the funds will be managed.
As a woman, I go to the markets every week, and we all know how hard these women work. So undoubtedly, we know that with access to this fund, it will rise their earnings and also reduce the gender imbalance.
We must be very careful just to ensure that we have enough if we really want to make a difference. If you want to make a difference to help the women of this country, 12 million is not going to make it. We need more than that.
History was made on Thursday with the presentation of the Persons with Disability Bill for the first reading by Minister Fatou Kinte. If enacted, the bill will make laws guaranteeing the rights, healthcare, accessibility, education and employment for those living with disability. Reacting to the development, Mohamed Krubali, President of the Gambia Federation of the Disabled, says even though the bill is presented before lawmakers, implementing it after enactment is more significant.
So the government ought to have respect for the bill. Other relevant stakeholders need to have respect for the bill to ensure that all the fundamental and inherent dignity and the rights contained in the bill are being observed and implemented. Some of these things will include education for persons with disabilities, employment, which is a major problem, provision of other relevant services for persons with disabilities are all key that we want to see that really they are being respected by the Gambia government.
Mamadou Gajega, QTV News.
The First Lady Fatoumata Barbaro on Friday took delivery of medical equipment from the First Lady of the People's Republic of China to aid the fight against coronavirus. As Aliou Cisse reports, the items are to be delivered to schools to protect students.
The donation from Madame Peng Lyon, the wife of President Xi Jinping, to the Gambia's First Lady includes 120 infrared thermometers and 18,000 medical masks. It is part of the support extended to all members of the Organization of African First Ladies for Development from First Lady Lyon. Ma Jianchun, the ambassador of the People's Republic of China to the Gambia, says the donation translates into action the commitment between the two First Ladies to foster the bilateral ties. The People's Republic of China recently published a white paper titled Fighting COVID-19, China in Action. It elaborates on how China, bearing the brunt of the pandemic, resolutely responded by taking the most thorough, rigorous and comprehensive measures, and how China actively cooperated with the international community in the historic fight against a common enemy.
I believe our medical materials donated to the First Lady's office will further assist women, children, and others in need of support in the Gambia.
The Gambia's Minister of Foreign Affairs, Mamadou Tangara, welcomes the donation, adding it will go a long way towards complementing the ongoing efforts by the First Lady of the Gambia to prevent the further spread of the virus.
This is a virus that is invisible. No one has a solution now. So the measures to prevent it is important for us to follow and respect. And that's why once again we will appeal to the public to cooperate. Government is not trying to impose anything on people, but all what we want is to save lives. These are difficult moments, challenging moments for the whole world.
First Lady Barbaro has ordered for the items to be given to the Minister of Basic and Secondary Education to be used in schools to protect the students. Minister Colonel Cole says the donation comes at a time when there are plans to open schools soon.
Right now, I want you to know that there are over 600,000 children
who are sitting at home and should have been in school, but they have been at home, could not have gone to school because of this pandemic. In fact, when the pandemic started, you, Your Excellency, you were out there in some of the schools and trying to sensitize the school children about the pandemic. And for that, we are very grateful. And I want to believe that the sensitization which you did to the school children have gone a long way, because up to this moment, as we speak, we have not heard of any school child who is affected.
As of Thursday, 17 June, the Gambia had reported 36 confirmed COVID-19 cases, hence the need for more concerted efforts to contain the virus. Reporting for QTV News, I am Aliou Cissé.
We will go for a short commercial break. The news continues when we return. Stay tuned.
How to live a real coffee instant. An exceptional coffee moment. With our Monty Instant Coffee, everything is possible. Discover the rich flavor of freshly roasted coffee. All you need is a spoonful of coffee, hot water, and it's ready for you to savor. Share your coffee break times with your friends. Choose Armanti Instant Coffee. Every day is an Armanti day.
Tobaski ak style ak QTV 2020 bii dara du yomb ana yéen ñi nga xamante yéenay designers yi teelo si ak ñiy jaay piis ak ñu xam ci def ba mu baax nee naa leen QTV ren dañuy dolli cere yokku ñeex. ak 2020 bii mooy suñu third edition bëgg nañ nag àndaat ak ñu daan àndal waaye nag képp ku ñu bëgg a dabit escalier lañ dañuy eeg ku bëgg a eeg kaa ñu eeg ndax QTV ku ci jaar dem jokkool ak ñun ci nu mu gën a gaawee 3244444 ak QTV ku ànd ak ñun dem ku ñuy seen sax da ngay dem.
Welcome back from that short commercial break. If you're just tuning in, this is QTV News. Now, the Gambia's Minister of Tourism and Culture, Ahmad Ba, on Wednesday joined fellow ministers of culture for a virtual conference to discuss the impact of coronavirus on the tourism sectors of the member countries of the Islamic Culture Education Organization. Omar Pijala was there and he fastened his support.
In line of the ongoing coronavirus pandemic, the meeting was held virtually via the internet. The meeting addressed the novel coronavirus pandemic's impact on Islam and culture in the member states. The objective was to formulate recommendations and propose policies and strategies to the Ministerial Conference on Islam and Culture, to the member states and to dedicate member state cultural institutions. The wider aim is to integrate Islam and culture perspectives in their response to COVID-19 and its consequences on Islam and culture. On behalf of the Gambia Cultural Ministry, Minister Ba said the pandemic has put the whole of humanity to a test, pointing out that Islam and culture are among the most affected by the COVID-19 outbreak and are having to endure the impact associated with the crisis and the restrictive measures imposed by states to stem its spread.
And I also believe that COVID have resubmitted us to God during our lockdown periods. Most of us took advantage of this particular moment to go into deep prayers, reflect ourselves, what we do, what we have done in the past. Where did we offend God? Where did we offend our neighbors, ourselves? And we reflected deeply and came out of COVID being very positive and indeed more committed to our religion and, of course, our relationship with our neighbors.
Minister Ba said what would make the situation worse is that most notably the least developed member states have fragile public health systems where populations are already facing countless threats to their health and livelihoods. Thus, it is paramount to come up with strategies to minimize the impact of the pandemic.
COVID again sent a message to those who thought they have the power and have everything in their hands. A mere virus disrupted the whole world. And that shows what God is and what God can do. Therefore, as Muslims, we accept it and we live with it. All what we do is to submit ourselves to Allah, and which we did very well.
He further explained that the Gambia has come up with a strategic response to post-COVID-19 by creating a national arts and culture fund to support artists, festivals, creators, writers, sound engineers, and etc. to cope with the consequences and negative effects of the pandemic.
We create this fund. We are looking for a seed money between $100,000 to $200,000 equivalent in our local currency, where we will start in helping our artists to develop and also looking into some of our positive cultural Islamic values that seems to be fading in some parts of our society so that they can be revived.
He warned that the spread of the virus may worsen the situation of Islam and culture, explaining that the pandemic has already had varying effects on people's livelihoods. He stressed that the coronavirus has intensified higher levels of poverty within communities across the member states. Reporting for QTV News, I am Omar P. Jallo.
A feasibility study for implementation of 150 megawatt solar park in the Gambia is being conducted by the National Water and Electricity Company NAWEC and the Energy Ministry in collaboration with West Africa Power Pool. Ajibintu Drame has the rest of that.
For years, West Africa has been plagued by poor energy supplies across the region. This was what led the regional bloc ECOWAS to set up the West African Power Pool WAP in 1999. WAP's overall aim is to establish a reliable power grid for the region and a common market for electricity. Progress towards this has been very slow so far. 10 years after the ECOWAS Center for Renewable Energy and Energy Efficiency (ECRI) was established in Cape Verde with support of the ECOWAS Commission, this region struggles to properly harness renewable energy. This latest announcement by NAWEC in keeping with WAP's aim to galvanize the project to achieve its aim. The power to be generated from the project will be integrated into the NAWEC network, as well as the Organization for the Development of the Gambia River Valley (OMVG) network, with the possibility of energy export. This will also be connected to the WAP Information and Communication Center to ensure secure and reliable operation of the interconnected power system in the ECOWAS region. This will help strengthen both the power system and the regional energy market. The managing director of NAWEC, Alpha Robinson, has this to say.
One of the things that we value and cherish is providing access to everyone in every single home in the country. And we're trying to do this by 2025 to beat the 2030 that was set as the target.
Mr. Robinson says the project will help cut down the cost of consuming energy and also bring a stable electricity and water supply. Mr. Robinson urges stakeholders to work collectively to achieve their goals.
One of the things that we're really lacking here at NAWEC is that energy mix, bringing in the more stable and more reliable HFO and fossil fuel-based systems and gas. We don't have hydropower, but bringing that along with cheaper energy sources will enable us to give back to the customers in the form of a reduced tariff.
The NAWEC MD goes on to say that the project's commencement is uncertain due to the COVID-19. Meanwhile, he shed light on the current water and electricity shortage that are affecting many communities.
But there are very complex issues facing both of these, and really a lot of it just has to do with the fact that the infrastructure we have is very old, hasn't been maintained or looked after, and we haven't been investing both in the infrastructure, in the assets, as well as in the capacity. And a lot of that has to do, of course, with 22 years of dictatorship.
The National Water and Electricity Co. Limited NAWEC is mandated to provide electricity, water and sewage services in the country. Gambians continue to complain about the irregular electricity supply and water shortage. The advent of a project to harness solar energy, which is something done by very few African countries, is one to be welcomed. Ajipintu Drame, QTV News.
Over 750 street vendors at the Serekunda market have been given an ultimatum by the Kanifing Municipal Council to relocate and operate inside the main market and other areas identified by KMC. Laurie M. Camara tells us more.
Out of 765 street vendors, the lucky ones will operate inside the main Serekunda market, but others are asked to relocate to Joshua, Abuko, Latrikunda German, and London Corner Market. At the press briefing, the market manager of Serekunda Market, Modunjai, said the deadline for vendors to move is Saturday, the 20th of June 2020, adding that the recommendation is based on COVID-19 preventive measures.
Since the spread of this disease, there are recommendations made: hand washing, wearing face masks, and maintaining social distancing are among the ministry's advice. The purpose of the task force is to talk to people to make them understand that the disease is real and people should adhere to WHO recommendations.
Pa Jabi, a member of Serekunda Market Committee, outlined the importance of moving street vendors, saying this will ease the free movement of motorists and pedestrians.
The only way we can prevent ourselves from this disease is by washing our hands and keeping social distancing. In the Gambia, the most congested place is Makumba Road and the Big Tree. Move street vendors to other markets is the only way to make social distancing work.
Aissa Tufal, PR manager at the KMC, highlighted that a task force committee has developed a plan to encourage the local vendors to move to other markets. She added that there is enough space to accommodate them in various markets, recommended for those who will be relocated.
While doing their shopping without being scared of getting infected with the virus as a result of overpopulated market. We are urging all local vendors, customers to help in making this campaign easy for all of us.
Fatu Per Choi, women's representative at the Serekunda market, says the market is very congested and call on women to operate from inside the market and maintain social distancing. Mama Kamara, a street vendor, she has had this satisfaction, saying KMC have been saying the same thing for past 5 years, even before the coming of the coronavirus. She said the vendors don't want to move from their present location and urged the government to look into the matter as we are all citizens. Loli Kamara reporting for QTV News.
Before we end this news bulletin, let's take a quick look at our main stories. At an event to receive a donation from the Gambia Red Cross Society on Friday, the Education Minister announced that grade 9s will be back to school on June 24th. The 19th June is World Sickle Cell Day, set aside by the United Nations for people living with sickle cell disease. Lawmakers at the National Assembly on Thursday continued discussions on the Women's Enterprise Fund and the Persons with Disability Bill 2020. The First Lady Fatoumata Barbaro on Friday took delivery of medical items from the First Lady of the People's Republic of China to aid the fight against coronavirus. Well, that is all we have for you in this edition of QTV News. Do join us tomorrow, same time for more news. Thanks for watching.